Hi, everybody. This is Todd Creager, and welcome to another episode of Let's Talk About Love, Sex, and Infidelity. I'm your host, Todd Creager, and today we have an exceptional guest here with us, Lana Kerr. So I'm going to tell you a little bit about Lana and why I have her on here. Because, I don't just interview anybody, as you know. It's got to be pertinent to some of the things I talk about, and I wanted to help maybe not every single person in my audience, but at least a good significant amount of them. So Lana is the founder and CEO of, let me make sure I'm pronouncing it right, Lumisque,
Yes, yes.
Lumisque. It's a pioneering skincare company she established in 2015. Lumisque has introduced the innovative CO2 Lift Carboxy Gel, which delivers carbon dioxide through the skin for rapid skin regeneration, lifting and rejuvenating the skin while reversing signs of aging. So you might be wondering why I have her on my show since I don't deal with dermatology, but there's more to it, even though that's great. I mean, that's really great. But following the success, Lana introduced CO2 Lift V, a gel designed for vulva and vaginal rejuvenation, enhancing lubrication and sensitivity. And, many of you know I deal a lot with sexual issues and sexuality through as we get older. And as we're getting older and hopefully healthier, there are still some parts of our hormonal uh, lifespan and physical lifespan that could use a little help. And I'm all for anything that could help us have wonderful sex lives. Why not? Well into our 80s, 90s, and 100.
Yeah.
Um, I say that because my mom, after my dad passed away, was 90, dated a man who was 100, and we have a YouTube video on that and how, I don't know what their sex life was, but it was something. Anyway, before Lumisque, Lana founded Your Fat Loss Coach in 2006, a wellness company offering customized weight loss and detox plans, along with nutritional counseling. Her organization has helped thousands, including high-profile clients like supermodel Beverly Johnson, achieve their ideal weight and image. Lana's remarkable achievements earned her a spot among the top 100 outstanding women in Broward. She is also deeply committed to community service, working with organizations like the Boys and Girls Club, Women of the Round Table, Prestige Club of Broward, and 211 Broward. Additionally, Lana is a prolific writer and public speaker. So we're thrilled to have Lana on the show today to share her insights and experiences. Welcome, Lana.
Thank you so much for that. And I'm really excited about this conversation we're going to have.
Yes, yes. So I mean, let's just start here. We're also going to throw in there something about the men, though. I do want to say that. That's something that we talked about before we put the recording on. So the first thing I want to ask you is, what are the impacts of decreased vaginal flow on women's health?
Yeah. Well, I mean, blood flow, the reduction in blood flow affects all parts of our bodies, right? Impacts our
Sure.
hair, impacts our skin. And I think most importantly, it impacts our vulva-vaginal area. And I say more importantly, because that's an area that contributes to the quality of life. Obviously, how we look is one thing, but that's about functionality. That's about how we feel, because obviously the benefits of sexual enjoyment and in sexual intercourse, they extend more than just pleasure. And so when blood flow slows down, it affects our ability to experience pleasure for both men and women. Blood flow slows down, and men have something, Viagra or Cialis that can help with that.
Hmm.
25 years ago, you talk to a man about that, and he would be like, "Oh, I don't have a problem," because there was no solution.
Right.
But now, because of their, they can address it and they have something. Well, we're in the same situation as women. We're just most things behind on we're past due because
Yes.
when
Right.
when when blood flow slows down, it affects our clitoris, which is on our vulva. So that's our vulva, and
Hmm.
that it for the clitoris to function optimally, it requires healthy blood flow, or it starts to atrophy like any other part of our body. It takes a
Sure.
longer time to get engorged. And that is all about the clitoris for your listeners who don't know. The clitoris is like the female penis.
Right.
It's
Right.
the same size.
Yeah.
It's internal. and it requires blood flow. It would be similar to a man having sex with a flaccid penis. Most women, are, because they just don't, the blood flow slows down, it doesn't get engorged. So that is one area in which blood flow impacts a woman's quality of life.
Yeah, they actually, in some of my readings that I've done, when you have an embryo, the tissue that creates the clitoris and the tissue that creates the penis is the same tissue as before it differentiates. So that all makes a lot of sense. Yeah, great. Um, so, all right. So here's a natural question to that. So, what are the potential benefits of vaginal rejuvenation?
Okay, so we talked about, okay, I think we want to stay to the vaginal. So we talked about the vulva. So that's why I like to say vulva vaginal rejuvenation.
Okay. Okay. Yes.
Because I
Yes.
think there's three
Right.
parts to a woman's, ability to experience pleasure. It's you have
Hmm.
for vulva, which has the clitoris. You have
Hmm.
the vagina, which is the tissue. So that tissue gets thin, just like the skin under our eyes. In fact, I've heard from a gynecologist that they say a woman's true age can be seen in her vagina just because that tissue, women treat their face. If we didn't do anything, put moisturizer, sunscreen, all of that to our face, we would show age in the same way. And
Mm.
so tissue, the skin in the vaginal skin is very similar to the skin under our eyes. It gets thin, it shows age first, it gets thin, and then it gets dry, it gets brittle, and they become painful. So the vulva, the vagina, and then there's the muscle, the tissue. So that tissue, that not the tissue, sorry, the muscle, that the pelvic floor that gives you that tightening. So there's three areas that need to be addressed as a woman ages, that she can, and it's treatable, that she can experience pleasure well into her, as you said, into your hundreds, if you can address those three things.
Yeah, okay, so that's good. So I'm learning here. I'm learning here, and I have to be clear what I'm saying, but I also uh, I'm always open to learning. So there's the vulva, which includes the clitoris.
Okay.
There's the vaginal tissue
Mhm.
that, like you said, looks like a face under the eyes. It's sensitive to aging, and if we put things on our face, as women do, and some men, it helps us, slows down aging. The same goes for there. And then there's also the vaginal muscle too. And all three of those are very important to pay attention to, so that people can have their highest functioning
Correct.
as long as possible. That's great. So, what are some of the different healing modalities helping that are available to help with obviously menopausal symptoms? That I know that some people hit menopause or perimenopause much earlier than others, but we all, there's a similar hormonal path that goes. There's certain other skin paths that go. So, I mean,
Yeah.
what are some of those modalities?
Well, as you said, it happens at different times for different women. Some of the impact of aging, perimenopausal, it can start from as early as in your late 20s, 30s. I've heard of women experiencing some similar symptoms.
Hmm.
So of dryness. So when we talk about vaginal dryness, obviously we're talking about the vaginal tissue, which gets thinner and then dry. So that can lead to painful sex. So that's the second modality. But thankfully, there are so many different things available now to help women in those three areas. I'll start with, most people, when they think of vulva vaginal rejuvenation, they think about surgery. So in surgery, what are the options? There's something called a labiaplasty, which affects, that really is more, I would think, more aesthetic. They want maybe they have, it's bigger than they want it and they want it to be
Hmm.
flat. So they can
Tighten it
do.
up.
So that's one area, which to me, it's all about matter of preference. I've seen so many in what I do. And we've done so many studies. I've seen so many vulvas and they all look different. And it's a matter of preference. To me, all vulvas are beautiful if it's functioning the way you want it to, right? So
Right.
there's
Yeah.
that labiaplasty. There's something else that's available, the vaginoplasty, which tightens the muscles again. So it's similar to like a facelift for your vagina. And I think that that's important to consider. If you would do a facelift when you're older, in your 60s, if some women, a lot of women do, why wouldn't you consider doing that? Because that just, even if you don't have children, aging loosens it. Think of an elastic band. So that elastic band, stretch and it pulls back, stretch and it pull back. Well, aging can make it so it's a little stretched. If you want to feel like a virgin again, like a young woman, you can get that, you can get it tightened. So that's one area. So that's surgical. And you can get, there's clitoral hood reductions, which kind of pull back the skin on the clitoris, so more exposure, similar to maybe a man getting circumcised, give you
Mm-hmm.
pull back the skin. So those are some surgical options that are available. Then you have things like radio frequency or laser that treats the tissue. So in those options, what happens is controlled damage to the tissue to now force the body to start healing. So making that tissue healthier, that's an option that's available.
Mm-hmm.
But now recently we have the first carboxy vulva-vaginal rejuvenation, and it's doing a couple things. It's doing one, the vagina. It makes it's giving that tissue a rebirth or reboot because you are introducing carbon dioxide into the tissue. So it's a very painless way. In fact, of
Mm-hmm.
all three ways, this is a there's no pain involved in this. It actually can be quite pleasurable. It's a gel that you mix, you insert it inside of the vagina, and that gel has CO2 gas. And it's a very natural way to stimulate the body to produce oxygen, to oxygen-rich blood to regenerate that tissue. So when you
Wow.
insert the gel, the oxygen, if it goes really back to basic science. So it's called the Bohr effect. When you change the level or the concentration of CO2 in the tissue, the body is forced to rebalance it. In what happens is that it's oxygen, it makes it very difficult for the body to transport the oxygen. So it's going to unload it in the area and pick up the CO2. And that's how you're getting that increase in blood supply and increase in oxygen. So that's doing the tissue, but it's
Wow.
also doing the vulva because now
Fascinating.
that requires circulation. For instance, in carboxy therapy, the CO2 lift V in particular, the CO2 lift can actually close a non-healing diabetic ulcer in as little as 8 days. So if you think of it, what's the problem that diabetics have? Circulation. That's why it takes longer to heal on their extremities. Well, if you put that same thing in that area, the same thing is going to happen. It's going to increase blood flow and circulation. So, and that lasts beyond the fact of beyond the time that the gel is inserted. The gel is inserted for 45 minutes to an hour. You can leave it on overnight, but the effects of it continue. Once a series is complete, a woman, you can now bring back the level of blood flow and tissue health to when you were in your 20s. And then you can maintain it with monthly treatment. So those are the modalities that are available to help a woman to regain youthful functionality.
Fascinating. Just fascinating. Now, are they, side note here, are they using this then for people that have diabetes and using
Yes.
this kind of, wow,
They're using it for diabetic ulcers. No, they're not using the CO2 lift V. They're using the CO2 lift gel for the
lift gel. Right,
difference with the
right.
CO2 lift V and the other CO2 lift gel treatments is the pH. The pH is perfect for the vagina. It's 4 to 4.5. As well, it has
Ah,
other components that help with certain type of inflammation that can happen or fungus that can happen for women down there. So it's perfect for a woman's vagina. But again, it's also for the vulva. It actually also has a nice aesthetic appearance. More and more women removing the hair down there. They want, that's just skin, just like on the face. They want it to be lifted and plump and tightened. It's going to give a nice aesthetic look. But most importantly, for me at least, the functionality is what you're going to see a dramatic improvement. Almost immediately, we've done several double-blind clinical studies on the CO2 lift V. And what is interesting, the last study we did, it was on 50 women, and double blind means that the patients don't know if they're using a placebo or the actual product. And the
right,
women use and the double blind means investigator also doesn't know which was used.
right, right.
Women that used the placebo showed no change in sexual function. All the women that use the CO2 lift V showed significant improvement in orgasm, in arousal, in desire, in lubrication. And then the biopsies
Wow.
was impressive. I mean, the biopsy, you look at that tissue of these women who had severe atrophy and look at it 10 treatments later, and they look like these women were young, youthful women.
I'm just thinking out loud here about, okay, even desire. I mean, because obviously everything's connected, mind, body connected, and all that kind of stuff. But I'm just curious how that works. I mean, that's fascinating to me. And it's such,
Fascinating. I was like, how desire? Because women that are getting placebo. They obviously they don't know the difference. I'm thinking
No, no,
exactly, and not
double
even
blind.
double blind. Only so it just shows you how important blood flow is. You know, I mean,
Wow.
it's going to. I mean, when I think of a man, you think of a man when your penis gets hard, it's it has there's some, I mean, obviously there's some reason why that's happening. Blood flow. Well, it's the same thing, but you have the ability to have blood flow, maintain it. Well, the same thing now with a woman. You know, if you get erect clitoris, it's going to affect everything. You want it to
Yeah,
know touch, and you want everything that goes along with that to happen. So I
yeah.
just very interesting myself.
I love it. All right. Very informative, Lana. Okay, that's great. So, a good question here. How can women make informed decisions about choosing the right rejuvenation treatment for them?
That's a great question. I mean, I have, you know, in this business, and I mean, obviously, I'm in the skincare, and I think skin is just not only the skin on our face, our neck, our knees, skin is everywhere. And then vaginal skin, vulva, all of that. And I think that I'm into all of that, but my passion is really into intimate skin. Just because I feel that, you know, as a woman in my 50s, I mean, that's a very important part of my life. It's a very important part of maintaining my relationship with my husband. I'm married now 27 years. And I think that intimacy is an important part of a connection, not only between your partner, but a connection with yourself.
Hmm.
So I chose, and because I'm in this business, I've experimented to see what I would choose. And I've talked to, and I work with doctors and physicians. So
Hmm.
I like combination therapy. I've always liked combination therapy. The V on its own is great. I mean, I've done that. I had to do other things because I work with doctors. They wanted to see how it pairs nicely.
Hmm.
Understand that the V, there's no pain. It's something that can be done in the privacy of your home. On its own, it's going to help you to feel really good. I have, though, done other things, other modalities like the RF and laser to see. I think what works is when you use it together, it's great because the CO2 Lift V is going to help to shorten the downtime. When you use those other modalities, what can happen, you need the microbiome to be rebalanced. So the CO2 Lift V is great at rebalancing that and
Hmm.
bringing that back so that you can function better. One of the things, you know, and I'm going to do is actually you're the first podcast I'm doing that I'm telling this on. I'm going to do a vaginoplasty just because, you know, I'm in this thing and I go to so many of these type of meetings and I'm like, I would do when I start looking old, for sure I'm going to do a facelift. Why wouldn't I do it for my vagina? So
Hmm.
I'm scheduled to do one. I'm actually going to be recording it. And what is fascinating to me about it is, and for the doctors, is that typically when you do a surgical procedure like that, there's normally 8 weeks of downtime. The CO2 Lift V is known for shortening the downtime significantly in any area. For instance, in plastic surgery, even if you're doing like, say, liposuction, and you have the swelling and the bruising from that, you can reduce it from 12 to 14 days to 4 to 5 days with the introduction
That's
of
huge.
the huge.
Wow.
So I'm thinking that with this, we're going to reduce the downtime from 8 weeks to 4 weeks or maybe 5 weeks on tops. So I'm anxious to see. I won't know until it's done. We're doing it in end of June. But so the options, and just to answer your question, I think the option, if you want something that privacy, even young women, and I recommend that women start early. Like, so you don't have to wait till you're experiencing the symptoms to start using this. You can actually prevent or reduce them, even having them by starting early, by maintaining that blood flow, as well as the fact that aging starts at 25 and anywhere, including your vaginal and your circulation down there. So if you don't do anything about it, by the time you're in your 30s, you're going to start experiencing a reduction in pleasure. But what are you comparing it with? The pleasure feeling is different from a picture because you can see a picture and recognize, yes, I'm getting older. You sometimes don't remember pleasure until you remember. So you can prevent that from
It's
happening.
true. That's
Experience
right.
great sex
Yeah.
and never end. So I would say the CO2 V is definitely prophylactic, is a great way to think about it. But for women who are experiencing the symptoms right now, do a course of 10, it's 10 treatments in the space of 2 weeks. It's affordable. It's something that you're going to notice, your partner is going to notice a difference. You're going to feel good in your skin. You talk about, when one of the reasons when I created the CO2 Lift V, what caused this, what made this happen? For me, like most things that I get involved in, it's something that I had a passion with. So I noticed a difference in my mid-40s of my sexual experience. And when I had gone to my GYN and explained to her what I was feeling, she was like, she did my exam. She's, Lana, you don't have a lubrication problem. I didn't think I did, and she didn't think so. But once we did the CO2 Lift V, oh my goodness, it's first of all, having lubrication and sustaining it for 3-4 hours, you can do that with the CO2 Lift V. That is just how it works. So not only getting lubricant, sustaining lubrication, the CO2 Lift V. Now, if you want to do even more of you have doctors who have vaginal rejuvenation with RF machines or laser. That's an option that you can take as well,
What
understanding
does
that
RF stand for?
radio frequency.
Oh,
So
radio
it's
frequency.
a based device. You have to put your legs up like on a stirrup. They put a probe inside, and you feel heat. So it's controlled damage to that tissue, whether you're going to use laser or RF, and some have something called RF microneedling, where it's actually needles too that are doing it. So there's definitely some discomfort involved, and there's some downtime involved. The CO2 Lift V is great for that too, because it's going to help to reduce that downtime. So that's an option. And then, of course, you can go the surgical route later on. I'm thinking of, and depending on when you are feeling these things, but this kind of fixes the pelvic floor, tightens that back up. So you feel like a 20-year-old again. If that's an option that you want, surgery is there for you as well.
That's great, Lana. Great, very complete, holistic answer. I love it. That's great. Um, well, you've been telling us about you. I love your, openness about yourself. So I could see where you've been inspired about developing this. I mean, the CO2 Lift V. Actually, how did you end up? You develop that? How does that come about?
Well, so going back to, as you said in the introduction, I was in the weight loss business for many years. I have always had a passion for just helping people to be better. And then it was just a natural transition to go into skin, because when people started to lose weight, they wanted to start taking care of themselves. But I was always looking for something as unique as our weight loss system. And, just interviewing people who had great skin, who were older than me, they had done carboxy therapy, but the version that people were aware of is with the needle. Because you see, carboxy therapy is a very old therapy. It really dates back to in Japan, when the samurai warriors would bathe in the carbonic hot springs, because carbon dioxide has always had healing properties. So they would heal very fast. So you can bathe in something in France, the same thing. You can bathe in it's hot springs that have carbon dioxide. But then the French developed a needle delivery system where they would just take the tank of CO2 and inject it into the skin. And it had great benefits, but of course there's a lot of downtime and there's pain. So we had just looked into Japan because I liked one of the things I like about Japan is onsens, and they have the carbonic springs there. So we just looked into there, and they had scientists who actually developed a gel delivery system. So we started a partnership with them, and we have the exclusive rights to that technology. So we're already using it for the face and having phenomenal results, not only for the face, for the body. So I just using that technology is when I had experienced these feelings for myself, I had said, I went to one of our medical advisors and I thought, wouldn't carboxy work well there? I mean, we're using it in everywhere else. So that's when we started with the pilot. We did as a pilot. And when we did a double blind as well, just with a small one. And then when we saw that it worked, I used it. And I was like, oh my God, this is phenomenal. Again, you don't remember until you remember. I tried it on before we even launched. I tried it on my mom, who was in her 70s, my aunts in their 60s. Oh my goodness, they went from sandpaper to butter. I was like, okay, this is it. So and then we've just invested in more clinical studies. And so in the last clinical study that's being published in IRB study, we saw also that it also helped with stress incontinence, because when women, their tissue atrophies, it affects, they cough, they'll pee. So it helped with that, and that affects your quality of life as well. So that's kind of the history on that. And we've helped thousands of women with the CO2 lift fee. And I think the biggest challenge that I've had is the fact that women, and it has changed, thankfully, for podcasts like yourself, Todd, and people talking about it, and more women too talking about this. I would say in the last 5 years, things have changed dramatically. Because I remember once this was back in, I think it was in 2018, I was on uh, it was on Today in Texas. And I remember it was in Breast Cancer Awareness Month. And I was with one of a gynecologist who uses this for women with breast cancer because it's hormone free. And I remember I was told we couldn't say the word vulva or vagina. So I was like,
Wow.
how are we going to describe this?
Yeah.
You're like,
Yeah.
just the word pelvic. Versus last year, I was on Today in Vegas, and we used vagina, vulva. Things have changed. I think it's just more awareness that is just really
Yeah. Thank goodness. That's
so that
great.
helped us a lot. But women, just as I mentioned on the onset, men 25 years ago, you talk about erectile dysfunction. What is that? No, I'm good. But no, there's a way that you can extend this and educate men, and here's a solution. Well, we're in the same position today.
That is great, and I'm going to get to men. I do have a question. I mean, you mentioned this, and this is true. I talked to a number of women, menopausal women, who obviously there's a loss of estrogen, and some said, "Oh, I've tested positive for BRCA, among the breast cancer, higher chance of breast cancer." So they just stay away from any hormone treatments. I've known people. I've done a lot of t talks with this local guy, well, gynecologist. She was an OBGYN. Now she dropped the OB, but and her and I have done many talks on increasing sexual desire. She would talk about the hormones and the physical. I would talk about relationships and trauma and how they all affect. And we've done this many times to many groups of physicians and therapists. And when I taught, I was a professor at USC, and I had her come in and talk to grad students, and so she's amazing. And she's referred a bunch of her clients to me. I've some that have. This one lady goes, "Yep, I'm late 50s, 16. She might be even 69." She goes, "I'm in the best sexual shape of my life," and she's doing the whole number that this gynecologist put her on, and it's great, very holistic too. But some other women are really gun shy about it. They just hear, oh, increase estrogen will increase chance of cancer. I talk to other gynecologists that say that too. Very different than the other gynecologist who's a lot more, well, it's not that, if you do it right, it shouldn't increase the chances, and she has all the data. However, hearing what you're saying, and it's hormone free, with that, I mean, I don't know how that relates to the estrogen, but it can still help, even if a person doesn't do anything directly with estrogen.
Yes, correct. So we've had so many breast cancer survivors who don't choose to do hormones. In fact, one
Right.
particular one, she actually started working with us. She had the BRCA gene. She survived breast cancer. She was recently married. She just had a child. She was in her mid 40s. And after going through all of that, she just couldn't have sex. It was very painful for her. She would bleed. You can imagine on a new bride how this impacted her. Her doctor had recommended the CO2 LFV, and that, she said, changed her life. So with that, she asked it be introduced to us as a company. She said, I would like to meet the owners of the company. It's changed my life. She now works with us. But
Wow.
again, so she, with no hormones, was able to, she said she has better sex after CO2 LFV than she even had before having
Wow.
cancer. Because what I
Wow.
did, it's about tissue health, it's about lubrication, it's about blood flow. Those are the things that this works on very naturally. So I mean, I'm a big hormone advocate for those who can take it. The thing is, I was on hormones before I experienced these problems. So I started around I started at 45, 46, and I was 47 when I started feeling a difference in sensation. So it wasn't anything, it was just quality. I was like, I'm not
Right.
feeling the same.
Right.
So in other words, hormones can be used in conjunction with this or not at all.
Mhm. Right. Right. Like I said, I know women that are open to it, and there's those that just almost have a phobic response. So for those women, and I understand it, when you hear the C word, they get scared, So, and like I said, the person that I've worked with, the gynecologist, has been, I've talked to her a lot about it, and I encourage people to go do their research and not just listen to some mainstream gynecologists that might not be. Not all gynecologists are created equal, just like in not every therapist, not every anything. So anyway, but that is good, for those people, whether they use estrogen products or not. So that's really good. So I want my audience to hear that one. Um, so okay, I do have to ask, before we talk about anything else, you mentioned the men. Let's talk about men. I know part of my audience are people that are men and partners of men who have had male sexual performance anxiety. I've had a lot of success with that, but I'm always ready to team up with other people. So tell me a little bit about that and how it helps with men.
Yeah, well, I mean, that was an interesting thing that we didn't really, that was never our focus. But of course, we have physicians who have male clinics who that's their focus. And when they understand what CO2 lift is doing for blood flow. And as we mentioned, blood flow is everything.
Yeah.
And they used it. So the protocol that has been developed that we did the pilot study on, and now your gynecologist is doing a study with a larger audience of men. Basically, they apply it to erectile tissue and you leave it on for 45 minutes. Some people wrap themselves with cellophane just so that it doesn't get messy. And they do it for 5 days, and it improves the shim score 5 to 12 points. So people were experiencing mild to moderate ED. You can see that they wouldn't even be in that position anymore. They would have to repeat that within 6 months.
Mhm.
But it's going to actually, so it's affecting the blood flow, so you get longer, harder erections. But also too, the skin is nice. The skin around it is smoother. The
Mhm.
testes are smoother, so it just rejuvenates and make that area look
Sure.
in. So
Yeah. Why not have beautiful testicles in the meantime? Yeah, why
exactly, exactly.
not? That's great. All right. Well, again, people are hopefully they'll be paying attention. Um, I like this. What challenges have you faced in bringing this topic into the mainstream conversation? Obviously, you've been doing plenty of it, and you just said it's getting easier, but you know,
Well, I mean, again, the hurdles, are falling. It roots from the fact it stems from just a lot of shame in sexuality. I mean, I think even
Mhm.
I was on a podcast once with a surgeon, a gynecologic surgeon, and he mentioned something which I thought was interesting. The name, the medical term for, I don't know if it was vagina or the vulva, but it was pudendum, which just means shame. So if you think of
Wow.
the term, that's where you get so much shame in it for
Right.
women, and
Right.
so that's why women don't talk about it. And if we don't talk
Yeah.
about something, then we don't identify a problem. In fact, if there's a problem, women don't like to say it because then it's almost like they feel as if it's a reflection of themselves as an individual. But if
Yeah.
they talk about their skin on their face, just because we're getting older on our face, there's no shame in that. We do things to prevent that. And
Hmm. Hmm.
why wouldn't we do the same there? So it has been, I think, a cultural thing across
Yes.
the board for that, which is changing. I think women are getting more and more, it's almost they feel that they have a validation to experience pleasure now. They feel it's okay. They have permission for some reason. And so
Yes.
they're able
Yes.
to talk about it. But I definitely think that is a big part of what we've experienced as a challenge, that people don't identify that there's a problem to have a solution, and
Right.
they don't know the impact of, when I was on the plane with someone the other day, it was the most interesting thing. She was in her 60s, and she asked me what I did and we talked about it, and she said something, and this is a woman with a big business, so she's educated. She said that she thought her husband, that no, she lives in Washington DC. They live, and her husband lives in West Palm, and they travel back and forth. But she thought her husband gave her something because she started experiencing pain in sex. So she thought her husband was having an affair. And then she
Wow.
told her sister, who was a couple years younger, and she's, oh my goodness, my husband must be having, because I recently started having pain in sex. I'm like, I was like, wow. So people, in other words, they don't know that this
It's,
is just
no.
aging. You know what I'm saying? So women don't understand that it's an issue that can be corrected.
Right.
It's normal if we didn't do anything about it, which would with any part of our body. So if you believe in improving the quality of life for other parts, why wouldn't you do that for that? So that those are the hurdles that, again, because of talk shows like yourself, just more education, people are getting comfortable with it and understanding that sex is a very important and natural part of life, that we can, and pleasure, we're created to have pleasure. I mean,
Yes.
the fact that our clitoris has double the nerve endings of a penis means that we were designed to have pleasure. So nothing
Yes.
wrong with talking about it. And that has been, I think, the biggest hurdle for us.
You're right. It has gotten better. I mean, this revolution has been going on for years trying to talk about it. I remember back in 1991 to 92, I was through the UCLA School of Medicine. I took a class in human sexuality, and the co-directors, one was a psychologist, one was a psychiatrist. And the psychiatrist, one of his so we would go through a 9-month program. It was a 9-month intensive program. But they also had medical students, fourth year medical students that were coming through on 6-week rotations. And his passion was to help these medical students think about sex and how the physical problems that their patients might be having, how it affects their sex life. I remember having this man come in. He was really excited because he wanted to be a nephrologist, kidney doctor, and he was on the nephrology rotation. So he was in heaven. And he comes in and he joins us. Again, these people came just for 6 weeks and they would go. But he came in and he talked about a few of the patients he saw. And I remember his name, Dr. Joshua Golden. He was one of the starters of this program. And he says to the student, fourth year student, he goes, so when you go to that dialysis patient tomorrow, I want you to ask how the dialysis is affecting her. I think it was a woman, could have been, I don't remember, his or her sex life. And he goes, "Yeah, I'm not going to ask that." He goes, "No, you need to ask that." He goes, I deal with kidneys. He goes, "No, you don't. You deal with people that have kidneys. And people that are on dialysis, oftentimes their sex life is affected by their self-concept and by other factors." And so anyway, he learned, and by those 6 weeks were up, he became a much more integrated, uh,
Yeah.
soon-to-be physician. Yeah, yeah, it's really
That's
good.
awesome. I think that's so important because we're dealing with, as you said, human beings. That's
Yes,
it. You're human, and the
right.
sexuality is a big part of human being, or we wouldn't be here.
That's right. No, it's
You know what I'm saying?
thank God for people like you and me, who talk about it. And my first sessions usually with people is let's talk about the tough stuff, and you're going to find this is a judgment-free place, and oftentimes if I sense or smell like something's going on here sexually, but they don't want to talk about it, it's always giving them permission. You have books that came out like Come As You Are, which is a great book on
Hold on.
sex and when
Well, the noise.
you have it right there. I,
Yeah.
I have it somewhere here too, but yeah, it's wonderful because it helps you realize we're all okay, and including sexual preference and gender and all that. Like it's all just different. There's nothing bad, nothing abnormal. It's all good. So come as you are, So these are the kinds of things and these kinds of conversations that people can start to look at. And like you said, if the person's taking care of their skin on their face, why not take care of the skin of the vulva, the vagina, look at the vaginal musculature, the men looking at, what's going on there, that it's okay if you have challenges. Why not? We have other challenges. And why not have the challenges there? Now that you could talk about it, what can you do about it? So it's
Amen.
really, really good. You've been very informative. Okay, so where can our listeners find more information about CO2 Lift V and all the other stuff and the rest of your work?
Well, I'm going to send you, which I don't know if I don't know if you have it, but I have two books that I think are really interesting. It's called, one is saying Say Yes to Menopause, and
Hmm?
one is about the other one is about the secret to the big O. So those are some great info, some great, it's short, but just a great read. But definitely my Instagram is the Lana Kerr, and I love getting DM'd on any questions that you have on that. Our other main page is at CO2 Lift and then at CO2 Lift V. So those are the ways that they can get us. And our website is co2lift.com. And for your audience too, Todd, we're doing a code for 10% discount, just Todd 10. And they'll be able to get 10% to try any of the products on the site.
That's great. That's great. Well, the listeners, I'm sure, and I'm going to encourage a lot of people to listen to this because, like you said, people shy away from it and they're missing out. So I want to make sure that as many people watch this as humanly possible, watch or listen. And you were really great. You know, any last things you want to share that you haven't gotten to yet that you could
I
think of?
I think you did such a great job with just directing the conversation. I think we've covered everything. I just want to, I think my final message, or what I always want to say to people, that, there's a big benefit to sexual activity in terms of health. It boosts our immune system. It is our stress level.
Yes.
It helps our
Yes.
connection with ourselves, our relationship. It grounds us. And, I find that so many women, especially women my age and onward, kind of just cut that part of their lives out. Well,
Mhm.
revisit it. It brings so much more color to your life. Revisit it and then use your imagination. I think that imagination is important in any area of our lives. In our businesses, we have to use imagination to stay current. In our cooking, whatever, we have to use our imagination. We need to use our imagination in our sexuality to make it fun and to make it different and to make it more meaningful. So I always encourage people to do that in their relationships as well, but definitely to always take care of that part of our bodies too.
That's great. It's right on a similar message. I oftentimes I like using the word imagination. I sometimes use the word creativity. I go, think how creative you are in your lives. You have to create a day. You have to create a day at work. You have to create stuff for your work. You have to create dinner. You have to create, and you also have to create a relationship. You have to create an intimate relationship. And most of us came from families where our parents didn't create. Well, I guess you can't help people create by default versus creating by design and by intent. What do I want? And to make that happen. So it's all great. Wonderful, Lana. It's been a pleasure talking with you. And I'm hoping people will reach out and you'll be able to have an opportunity to help more people through this interview. So
Thank
thank
you,
you.
Todd. Thank you.
All right. Take care.
Well, Todd, before you go, okay. Well, I mean, okay.
Yes, 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 yes. I'm going to talk to you after this recording. Take care. I'm going to stop the recording.